Here today, there's a group of physicians and staff from Tryon Medical Partners, and we're operating a satellite clinic outside of our regular offices to screen patients for COVID-19 infection. One of our most important goals is to make sure that we don't expose our healthy patients to our sick patients. So we're running into a lot of difficulties making that happen effectively in the offices. So we've developed this satellite location for Tryon Medical Partners, and we're diverting all of our ill patients to this location so that they don't come into contact with our well patients at the regular offices. So most patients have been pretty receptive. I think a lot of people feel kind of bad and they don't really want to go to the office anyway. So the idea of pulling up and not getting out of your comfortable car has been well accepted. And I think most patients are very worried about the possibility of contagion. They don't want to make other people sick. They don't want to get sick from other people's germs. So staying in your car is a really good way to isolate whatever infection you may or may not have. So each patient has been pre-screened by phone by one of our staff members at a central location as far as what upper respiratory symptoms that they have. So they're going to pull up in their car and they're going to be checked in by one of our non-clinical staff members. We're going to be practicing safe distancing, personal protective equipment, hand washing throughout all of this process. Then each car will be directed into a numbered spot where myself or our nurse practitioner will approach the car in personal protective equipment, do a quick interview with the patient, determine whether or not they need to be screened. If we think that they're at high risk for having COVID-19, we will first screen them for influenza. The patient will wait in the car for about 20 minutes until we have that result back. If the patient tests negative for influenza, then we'll test them for COVID-19. So the most important thing to remember is to not panic. We are armed with knowledge and resources and staff who are available to help you, and so there's absolutely no reason to panic. If you are sick, the most important thing to do is stay home. Unless you're having a medical emergency, you should stay in your house and contact our office by phone so that we can give you directions on what to do next. So people who are well, first of all, right now the most important thing to prevent the spread of COVID-19 is social distancing. I'm sure you've heard a lot about this on the media. It's not a snow day. It means staying home and not engaging in social interaction outside of your home unless absolutely necessary for medical purposes or for other reasons. As far as preventing the spread of influenza and COVID-19, washing your hands is really, really important. That's the number one thing you can do. The use of personal protective equipment like masks and gloves and gowns is not necessary for healthy persons who are staying in their home. At Tryon Medical Partners, we have a task force for the coronavirus that began operating several weeks ago, trying to determine, what's going to be the best course of actions to protect our patients, protect our staff, to identify cases. To my understanding, there are some other groups doing this, but I believe Tryon Medical Partners is the first independent practice doing the satellite testing for COVID-19. We are the largest independent medical practitioner in Mecklenburg County, serving over 15% of the individuals in Mecklenburg County, so it's really critical that we are able to provide this service for our patients.